Them being raising the age to 21. And people can agree that, or disagree that that's something that we should be doing, people's rights. And I think it's a good health policy. Hawaii passed it last year in 2015. California just passed it out of both chambers. New York is working on legislation and in their legislature. Massachusetts and also 135 towns and cities have also taken the approach of raising the smoking age.
Why 18? Why is it that we want to target 18? Because statistics have shown us that at that young age, when children start to smoke, it becomes more difficult for them to quit smoking as they become adults because they've started at that young age.
Raising the sale age of tobacco products to 21 as a promising intervention at a time when, in Connecticut, every year, tobacco kills more people than alcohol, AIDS, car crashes, illegal drugs, including heroin, accidents, murders, and suicides combined every single year.
Many continue to smoke despite the knowledge of its effect on their failing health. I watch as my patients literally struggle for breath, even when they're at rest, and they can no longer participate in work. Many have to retire early because they can no longer function, and they can no longer participate in family activities that bring them joy.
90%, 99% of all adult smokers reported started smoking before 25 years of age, and almost 80% of adult smokers smoked when they were in high school and before. So anything we can do to prevent that from them starting down that path is, again, one in the win column.
So you have smoking, which leads to heart disease. You have heart diseases that cause the deaths, the incredible amount of deaths that we see, unfortunately, in our state. And when you put the two and two together, it's not rocket science that tells you that we need to look at smoking. Smoking leading to heart disease, leading to death. So where do we begin this equation? We begin with smoking.
Connecticut has received over $2 billion since 1999 from the tobacco settlement. $2 billion. How have we used that? How have we used that and spent that money for the reason that it was settled on, and that is to reduce the amount of people smoking here in Connecticut?
That money that comes to our state, $2 billion that has come to our state, for us to go into the general fund and not be used for what it is meant to be, I think is unacceptable, is atrocious.
I think it's time that Connecticut takes the approach that others are. If we're not going to spend the money, put it into advertising, then a simple way to do this is raise the age of smoking to 21.
If you want to improve health over a long period of time, it's smoking cessation and obesity epidemic. And anything we can do to prevent children from starting to smoke.
So helping to prevent youth from ever starting down the path of nicotine addiction would be an incredible success.
We are gaining grounds on this war. But have we gained enough? Have we done enough? And the answer is absolutely no. We are doing things, but we need to do a lot more.